Hello, my name is Mohel Rabbi Avraham Rubin. As a certified Mohel, I'd like to discuss different people who come with me with different issues and questions related to circumcisions and different things that bother people that they'd like to know and hear about, and therefore I felt like it was a good idea to share with you and with the public. One of the main questions people ask me as a Mohel is, what is my main concern when doing a circumcision? Actually, that question is in a way very senseless, because there's no main concern when it comes to circumcision. There's only one concern, and that is the comfort and the safety of the mother and the child, mainly the baby, as the mother usually has a lot of effect on the baby, and I'll discuss that in short. When I'm called to do a bris, I'd like to see the baby before the bris, which is 2 or 3 days before the actual circumcision. And I go and check different signs of the baby just to make sure the health is okay, and the environment is okay for the baby. You know, I before you do a bris, a circumcision, you want to make sure the baby is going to be taken care of. Therefore, I go to the house and I usually check for a few things. Mainly, I'm checking the baby, and I'm looking at 3 signs of the baby, 3 basic signs. I'll put them in categories, really. I'm looking at the color of the baby just to make sure the baby has the proper colors. You know, that usually is a sign of the health of the baby. You know, when you're doing a circumcision or any type of procedure on the baby, the health is #1 thing. Secondly, I'm going to look at the reflexes of the baby. You want to just make sure that the baby has proper reflexes. You know, God created us that way, that each one of us has reflexes that's just part of creation. And the third thing is just the general health, looking at the different sides of the baby, checking the head a little bit, checking the back, and different, you know, the breathing, just to make sure all the signs, you know, the baby looks perfectly healthy before you do a bris. As we know, we don't want to in any way put the baby in harm, and therefore these things have to be checked before the bris. Now, before the bris, there are a number of things we tell the parents. One is, we ask that the mother, if she's nursing, she should not nurse within a couple of hours of the actual circumcision. For the milk of the mother, when it goes into the baby, usually the mother is tense because of a circumcision, and that milk goes into the baby, and that could cause stomach cramps. It happens all the time. Most babies that were nursed during the bris, usually, this is a study that I've done over the past few years, as I've been involved in many circumcisions. I see that there's certain babies that cry a lot. I can tell if the mother nursed it. That's an interesting thing about circumcision. Another thing, we ask that the mother does not make sure the baby is well fed before the circumcision. As we know, babies that age, they're bothered by very interesting things, such as when they're hungry, as we all are. And another thing is, they're not used to having their diaper open, and when we open the diaper, usually the ear also affects them, and that causes them a lot of discomfort, and usually babies cry in the first month or so of changing their diaper. Every parent knows that. Therefore, we try to minimize their discomfort, and by doing that, we make sure that the baby's well fed, we make sure the baby wasn't nursed, formula is good, and we also make sure that the baby is comfortable and warm before, during, and after the bris. Once the baby is brought to the synagogue, or if the bris is done at home, or the circumcision is done at home, once it's there, it's basically in my hands, just to make sure that the baby gets well cared for. Therefore, what I do is, before I go to any circumcision, I check all my instruments that I need for it, which are not a lot. I make sure that they're all well sharpened, and they're all the sterility is 100%. Sterile is a very, very important thing, as just God forbid that there shouldn't be any type of infections. We do more sterility than is required even by hospitals. We wash our hands thoroughly for a long time before. We don't touch anything that morning, and we're very, very strict regarding the sterility part of the circumcision. The instruments for bris as circumcision are designed for a few things. First of all, they are specially designed for circumcisions to minimize discomfort and to maximize effectiveness and exactness on the bris. Every single instrument has its special use for it, and especially designed by trained mohalim for many generations. As we know, the Jewish tradition is that every single baby at the day of, once they turn 8 days old, they have a bris milah. So it's something in the Jewish religion that we really understand, and for years and years they've developed different types of techniques to make it less painful for the baby. Therefore, those are the instruments that I have, all up to date and beautifully shined and sharp, so that the baby feels the most minimal discomfort. As you also may know, a baby in the day of 8th day, the 8-day-old baby usually hasn't developed its full senses, and therefore the actual bris milah will not cause the pain that you may think it causes. As you will see after your child's bris, you will see that after the baby's bandaged up, the baby will not be crying for more than 20 seconds after. Actually, the whole time the baby cries won't be more than 2 minutes, and I can't guarantee it, but that's almost always by a baby. Besides, again, for the mothers who feel it necessary to nurse their baby before. But other than that, the babies usually will not cry after, as the senses aren't as strong, and once they're bandaged up, it's basically a quick procedure. The discomfort is something that we pride ourselves, and I pride myself, on making sure that the mother and the baby feel at ease. And therefore, these are very strict adherences that we were trained for many years, going around with different mohalim and doctors, and seeing from a lot of them how not to do a bris. Whereas I've been in hospitals where they've done bris and it's circumcisions, and the baby went through a lot of discomfort, with which they used incisions, and they used very strong instruments, and they used clamps and all different types of instruments that cause undue pain. We stay far away from that. After the bris is very interesting. Mothers think that they have to care for their baby for a long time after the bris. Actually, between 24 and 48 hours, the mother is basically off the job. The baby is almost fully healed. Besides, for just the look is a little colored. After the bris, I will train you to care for your baby for the next 24 to 48 hours, and then I will personally come to your house and I will take off the bandages and check the healing and send your baby back to school. Doesn't that sound great? Well, not only that, during that time that you will be caring for your baby under your watchful eye, you will have my personal phone number, and you will be able to call me and reach me at any time, and whether your concern is serious or not, I'm not further away than the telephone, and therefore, just to minimize again your discomfort and keep your assurance and just keep you strong regarding this procedure and ceremony that you just endured. Another aspect about the healing part, the healing process. After the bris, there's a bandage placed around the baby, around where the circumcision was done, and that bandage stays on for the next 24 to 48 hours, and you're basically just changing the gauze on top. The gauze on top is a very simple procedure. All you need is a little neosporin, or a little triple antibiotic ointment, or any type of bacitracin, and that basically is all you need for it. And the main thing you will need is simcha, which is joy and happiness, as you watch your baby grow into a young adult and see only much nachas and joy from him. Again, my name is Rabbi Avraham Rubin. I am a Mohel, a certified Mohel. That means I do circumcisions. And if you'd like to reach me, you could call me on my cell phone any time of the day or night, actually, at 646-709-1374. That's 646-709-1374. You could call about your upcoming birth. You could call about a future birth. You could call if on just general questions. I'll be happy to talk with you. And if you'd rather email me on the web, you could email me at rabbi@simohel.com. That's rabbi@simohel.com. Or you can look at all my information on www.simohel.com. That's www.simohel.com. Thank you for listening.